in terms of back pain, just can I get a show of hands of how many people have had niggly back pain in their lives? How many? That's a lot, right? That's a lot, and that's kind of consistent with the statistics. And if you type into that bastion of knowledge, Google, and type in "how do I fix my back pain," you get endless scrolling, and you can see massage therapists, chiropractors, osteopaths, physiotherapists, musculoskeletal physicians, neurosurgeons, spinal surgeons, and they are all in the industry of treating back pain. And that's kind of one of the problems, is that there are many, many people that are treating back pain, but back pain is a symptom. There is almost nobody treating the cause of back pain, okay? And that's a big problem. And with any condition, any medical condition, if you have a paradigm that just manages the symptoms and ignores the cause, that intervention will ultimately fail. You may alleviate symptoms for a little while because it is a symptom-based approach, but if the root cause of the problem is not resolved, it will rear its ugly head again and start to cause symptoms. And interestingly, it ties in very nicely. The parallels with metabolic health and nutritional health are very similar. They're the two of the few conditions in medicine where the industry is quite happy to manage the symptoms. Think about what we do for diabetics and things, but ignore the cause, okay? And this would never happen in fields like transplant surgery, okay? So imagine that you've got emphysema and you need new lungs, or you've got cirrhosis and you need a new liver. And the transplant surgeon would never give you a new lung or a new liver if you were still smoking or drinking, because the smoking and drinking is the problem that caused it in the first place. You just wouldn't be on a transplant list. Okay, but when it comes to musculoskeletal health and metabolic health, the industry is still very happy for you to be consuming glucose, which you're intolerant to, or moving with poor quality, despite you being a victim of that cause. And this is an example of it. This is a study published in the Lancet. It's a little rag called the Lancet, and there's three professors on the authorship, and I find it quite incredible that you'd put your name to such a statement. So we already know that back pain is one of the leading causes of disability on the planet. But you've in the third line of your research paper, you've admitted that there is no cause for it. Okay, and that just makes no logical sense to me. And I see it all the time in my medico-legal work and insurance work. I see certificates, and these pieces of paper are going to be held up in court for a judge to determine. And the diagnosis is quite often listed as back pain. Okay? Back pain. It's a symptom. Back pain is a symptom. You cannot use a symptom interchangeably with a diagnosis. Okay? So they don't actually even recognise a diagnosis for one of the leading causes of disability on the planet. So what is the disease then, I'm sure you're asking, that causes back pain symptoms? But before we get there, what is the back? Okay, the back is simply part of our spinal column. What is the spinal column? It's a series of joints layered on top of each other. And what's the spinal column for? Okay, it's for support of our viscera, our torso and our abdomen. And it allows us to move in space. It allows us to transfer energy from our hip extensors and our lower limbs to our upper body and to move in space. And what determines the health of the spine? So the most significant factor that determines the health of a joint is the way it moves, okay? Very simple, non-conjectural, okay? I'll just demonstrate. If I walk around, I want you to look at my ankle. Can you see my ankle? Okay, so I'm just walking around here. I'm moving my ankle, I'm walking. But clearly, you guys probably aren't orthopedic ankle surgeons, right? But you can see very clearly that the way I'm moving my joint is not correct. It's dysfunctional. Okay, so what's going to happen to my joint if I keep walking like that? It's going to be compromised by the biomechanical. I'm going to do that. Put it right now because that hurts. But it's going to be compromised by the biomechanical stress, because biomechanical stress transfers to biological inflammation. Inflammation, as we know, is painful and harmful, and you will eventually get structural changes as a consequence of persistent inflammation, chronic inflammation. Okay, so it's quite a simple concept that spinal joints become unhealthy if we don't move them well. Okay. So the primary function of the musculoskeletal system is movement, and a failure of that system, by definition, means that we have a disease called movement dysfunction. All right. So what I want to do is demonstrate movement dysfunction. So who would like to come up on stage, and we're going to do a quick diagnosis of movement dysfunction. Who's keen? Okay, come on up. Now what I want you to do, give her a little bit of a clap. You're very brave. She looks quite, hello, what's your name?